Welcome to another exciting episode of Ask Dr. Leila podcast. Here today is our talented Dr. Safa. She's graduated from Ajman University in 2016, and she's dedicated her life to pediatrics.
Thank you so much, Dr. Leila, for having me today.
Let's dive right in, Dr. Safa. Could you share a bit about your journey in dentistry and what led you to this profession?
Yeah, sure. So when I graduated from Ajman University, I started working as a general dentist. I've treated a lot of adults and a lot of kids, and I felt that kids give me a different feeling when I treat them, when I give them a positive effect. And when they enjoy their visit and they come back again and ask for me, it gave me a different feeling. So I felt like I want to do this.
Absolutely. There's a lot of gratification with treating children. I know it because for years I actually treated a lot of children, and I know it takes a lot of patience, which I see that in you, and just being all in all a happy person to pass that positive energy to the kids. And then at the end, the gratification, I think, is something huge.
And I think it's all about how they feel. Like when they feel you're interested and you're interested in them, and like you like what they're doing, or you ask them about details, it makes a huge difference.
Yes, they feel grown up.
Yes.
We're delighted to have you on this team at LHDM, Dr. Safa. Speaking of LHDM, what do you think sets our clinic apart from the rest of the clinics in Dubai?
I feel the clinic is very unique from the part where it has the latest technology combined with the environment is very friendly. The team, they welcome the patients in a very friendly way, and also everyone makes sure to give the patients the best treatment plan for them. So this is a really, I feel it's really good thing.
So patients come first.
Yes.
And that's an absolute must here. It's something that we talk about with the staff, with the doctors. At the top of the pyramid, it's always patients first. Can you share a memorable patient success story? Perhaps a patient you cannot forget.
So yeah, there is one patient, she had a dental phobia. She came to our clinic and we tried all the ways to make her sit on the dental chair. She sat, but she refused to open her mouth. She was crying the whole time. And then I was trying to explain to her what we will do. And then I gave her a mirror and I was showing her the decays she have and how we will fix it. It's very interesting how the whole thing shifted when she held the mirror. And she requested the treatment to be done while she's holding the mirror. So we did the full mouth rehab while she's holding the mirror every visit. And she was very interested in checking what we're doing for her teeth. And this has shifted the whole treatment. Even the parents were shocked about how cooperative she became and how excited she was to come to the clinic, just because we found the way to understand what she wants. Like, she just wants to see what we're doing. She's the type of kids who doesn't want to lay down and open her mouth without understanding what's happening.
Exactly. And I find out with children especially, we need to take them step by step in the process and explain everything beforehand, obviously, especially since they haven't had the years of experience of being in a dental chair, so they don't know what's going to happen. The mirror part is really important because you incorporated her as part of, the journey. But I think there's a fear part on our behalf, right? That at any point she might see something and be really scared as well.
True, but at the beginning we tried the other way, which is you don't show everything and you open the TV and distract her. It didn't work. So I was just trying, just trying all the ways that's possible. And she was seeing a lot of, she saw so many sharp instruments, but I was telling her the process, no, this one, it will do this one, it will do this. And then she was okay, and in a very magical way, let's say.
I think pediatric dentists are magical themselves, and they have to be extremely flexible because each child that walks in has a different background and a different need.
And then it's all about how you need to understand their personality. You can't treat all of them in the same way. There is no manual for this. Like every kid, he has his own personality. Like for adults, they come and they tell you, I don't want to see this, or I don't want to do this. But for kids, they don't. You just have to figure it out yourself.
Which keeps you on your feet and keeps you young. And on a lighter note, any funny stories that you can share with us?
Yeah, there is a funny story. It was a tricky one. I had a patient. It was her first dental visit. And so we did a full checkup. We took x-rays. We did preventive treatments. And then she left. And we usually give them toys to encourage them to love the dental visit and to enjoy, to feel like they got
reward.
Yes, a reward. Yeah. So then, after 2 days, the mother comes as an emergency with her child, saying that she had pain. I did a full checkup again, and there is nothing wrong. She has a perfect teeth. And then I told the mom, maybe she ate something sharp, maybe, and then she left. Then after 2 days, she came again with an emergency and pain. So me and the mom, we were asking her, and then we found out that she didn't have any pain. She just wanted to come to visit me, to take the toy and leave. But she was telling her mom, my teeth hurts, so she will take her to me. Like, she bring her to the clinic.
Amazing.
And this patient, I can't forget. Like,
absolutely.
Like, she made a big difference for me.
Oh my goodness, what a story. That's one to remember. Beautiful, beautiful. Here at LHDM, what could you say that we have to help relax your patients more?
Okay, so first, I feel it starts with the reception team, because once the kid enters to the clinic and he finds a friendly environment, they feel safe. They don't feel scared. Like, they don't feel they're going to a strange place. And if they see smiling faces all around, it makes a difference. And then we have a TV, which is a very good distraction for them. Once they sit on the chair, they watch whatever they want to see.
And it's right above them as well. Yes.
Yes. So once they're laying down, they can see the TV. They can see their favorite show. And we also have the nitrous oxide sedation for the kids who have fear of the dental appointments. It helps them to relax a lot. And of course, after the visit, we have the toys, the trophy to make them feel happy and encourage them to come back again.
And their picture goes on our cavity-free club.
Yes.
That's amazing. And every time they come back, they see their photo and they're so proud of it. Dr. Safa, what advice do you have for our listeners in maintaining good oral health and ensuring a positive dental experience for their children?
Okay, so first, I can recommend doing regular checkups. It's very helpful to detect early cavities, or we can inform them about how to brush properly, do flossing in the right way, and then balanced diet, of course. And then the regular checkups can indicate if they need an early orthodontic treatment, if they need hygiene appointments. These things will help to build the right habits at early age, which help them when they grow up to find it easy to maintain this habit.
True. Everything starts at an early age to build those habits. And for some patients and parents that would like the prevention aspect of sealants, for example, I'm just throwing one of many preventative aspects out there. Maybe you can just give us a little talk on sealants?
Yes, sure. So the idea of fissure sealants, especially we use it on the adult teeth when they erupt. Sometimes we use it for primary teeth if the kid have high chance of
deep pits.
Yes.
Mm-hmm.
So to prevent cavities, instead of drilling the tooth after it gets cavitated and maybe sensitive, we just put the material, which is the fissure sealant, on the deep fissure to cover the area that it will prevent the food getting stuck in.
Right. Because I see it with myself. Sometimes I think I've done a thorough job And then I feel there's still plaque left in the deepest pit. And it's as if my toothbrush is just going right over it.
And it can't go in because some people, they have a very deep fissure that even the soft brush can't go in to remove the debris or remove the remnant food.
And as I've always said, prevention is the best method. So anyways, thank you, Dr. Safa, for being here today and sharing with us your heartwarming stories.
Thank you so much for having me.
Before we wrap up, can you tell us anything about any of our community or awareness initiatives that we're going to be having at LHDM?
Yeah, sure. So we're planning to have many campaigns for the school to educate kids about how to take care of their teeth. We always believe in giving the society these tips and helping kids to encourage them to take care of their teeth, follow the right methods of how to brush, how to floss, how to eat the right food to reduce the cavities and the teeth problems.
Yeah, I tell them, you see me less and see me for fun things in the chair. No, it's always great to give back to the society, when the knowledge is there and we have the ability to do it. And it's really rewarding and a lot of fun. A lot of behind the scenes goes in it, obviously, to be able to execute it. But we all sit back and really enjoy those beautiful smiles out there. Again, thank you for joining us and for everything you do here at LHDM. Thank you, everyone, for tuning in and our second season podcast at Ask Dr. Leila. For more exciting discussions to come with our other specialists, please tune in. And until next week, have a lovely week ahead.